Hi, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. This week, city employees submitted questions related to gathering on Thanksgiving and COVID-19 in health and safety. Thanksgiving, along with other celebrations that occur in the fall and winter, typically include large gatherings of family and friends, crowded parties, and travel that may put people at increased risk for COVID-19. WT from the Corrections Department asked, "My family is making plans for our Thanksgiving gathering. As we prepare our guest list, does the Department of Health have any recommendations to help reduce the risk of coronavirus outbreak at our family get-together? Please keep in mind that gathering with people, including extended family, friends, and associates, who live outside your immediate household increases the risk of attendees spreading and contracting COVID-19 during gatherings. The City of St. Louis Department of Health recommends celebrating virtually or with members of your own household because it poses low risk for spread. Make sure you inform guests to stay home if they do not feel well or if they are at higher risk for getting very sick from COVID-19. Individuals should not attend if they have been exposed to COVID-19 in the last 14 days or are showing COVID-19 symptoms. Invited guests who live with people who are at higher risk for getting very sick from COVID-19 should think about the added risk to their loved ones if they attend. Persons with the following conditions are at increased risk for severe illness from the virus that causes COVID-19. Cancer, chronic kidney disease, chronic obstructive pulmonary disease, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state or have a weakened immune system, obesity, severe obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. In the event someone who attends the gathering tests positive for COVID-19, it is important to keep a list of those who attend to ensure all close contacts are properly identified. This list will be helpful if you are contacted by a health department disease investigator. SM from the Refuse Department asked, "Does the Department of Health recommend limiting the number of guests?" That's a great question. Although the Department of Health recommends you not have a gathering with attendees from outside your immediate household, if you do, we recommend keeping the gathering small. It will be ideal to limit the number of individuals attending as much as possible. Keep indoor gatherings to 10 people or fewer, and outdoor gatherings to 25 people or fewer. Wear face coverings and make sure guests stay 6 feet away from others who do not live in their household. Also, for indoor gatherings, when possible, it is a good idea to open windows and/or doors to allow increased airflow when possible. Some additional considerations for hosting a holiday celebration are: provide updated information to your guests about COVID-19 safety guidelines and steps in place to prevent the spread of the virus. Provide or encourage attendees to bring supplies to help you and others stay healthy. For example, extra masks, do not share or swap with others, hand sanitizer that contains at least 60% alcohol, and tissues. If you are planning in-person holiday gatherings with people outside your household, consider asking all guests to strictly avoid contact with people outside of their household for 14 days before gathering. JP from the Streets Department asked, "Is it okay to serve our Thanksgiving meal buffet style?" Food is important, JP. The City of St. Louis Department of Health joins the Centers for Disease Control and Prevention's recommendation to avoid any self-serve food or drink options such as buffets or buffet-style potlucks, salad bars, and condiment or drink stations. If serving any food, consider having one person serve all the food so that multiple people are not handling the serving utensils. Also, use single-use options or identify one person to serve shareable items like salad dressings, food containers, plates and utensils, and condiments. TR from the Board of Elections Commissioners asked, "My extended family is planning a gathering in another state. Does the health department have any travel recommendations?" Again, that's another great question. This question has been raised frequently over the past few weeks. Traveling increases the chance of getting and spreading COVID-19 to others. Staying home is the best way to protect yourself and others. If you travel, it is critical for you to know your risk. The lowest risk includes staying at home, which is the best way to protect yourself and others, or taking a short trip by car with members of your immediate household with no stops along the way. A little more risk is associated with longer trips by car or RV with one or more stops along the way. You further increase your risk by taking trips by car or RV with people who are not in your household, or taking long-distance train or bus trips in direct flights. And the highest risk is associated with flights with layovers, or traveling on a cruise ship or riverboat. If you travel during your trip, take steps to protect yourself and others from COVID-19. Wear a mask to keep your nose and mouth covered when in public settings, including on public transportation and in transit hubs such as airports and stations. Avoid close contact by staying at least 6 feet apart, about 2 arms length, from anyone who is not from your household. Wash your hands often or use hand sanitizer with at least 60% alcohol. Avoid contact with anyone who is sick, and avoid touching your eyes, nose, and mouth. If you participate in higher risk activities, are unable to implement COVID-19 prevention measures, and think you may have been exposed before or while traveling, it is recommended that you quarantine for 14 days upon returning home. Thank you so much for tuning in this week, and thank you to everyone who sent questions. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Have a healthy and safe holiday season. Be well.